Hi, everybody. Welcome to Cox Connections. Brad Grundmeyer, Director of Public Government Affairs for Cox, Louisiana. Thank you so much for tuning into our show. In this segment, we're going to be talking to our great friends over at People's Health and the great work that they've been doing. Joining us on this segment is Jose Amadeo, who is the Manager of Special Markets for People's Health, to talk about some important information regarding Medicare and Medicare Advantage. But we'll talk to him a little bit more about that. But good to see you, Jose. Welcome to the show.
Too. A pleasure to be here today.
Thank you so much. Tell me a little bit about what the great folks at People's Health, what they do and what their mission is.
Yes, People's Health is a local company established in 1994, based here in Southeast Louisiana. Yeah. Our main office is in Metairie. We also have another office in Baton Rouge. And we work Medicare Advantage plans. Okay. We are only focused in Medicare Advantage plans since 1994, and we cover all the parishes that we have in our list for our members.
Excellent. And it's a great organization, been around since 1994?
1994
yeah.
is owned by physicians, so the same physicians that work with our community is in charge of our plans, and they also manage our plans for our members.
Nice, because that's important when you're a part of the community, you understand the needs of the community, and that's beneficial to the programs that you guys offer.
Right, because we live like you here yeah. in Louisiana. You don't need to call to other state to get
you're going to get someone from the state.
Right, it's
excellent.
All in the same office, so we are with member service, with our nurse, social workers, in your neighbor.
Now tell me about this, even younger or old, regardless, don't really quite understand Medicare and how that intertwines with your health care. Tell me a little bit about Medicare. Obviously, it's a government health care program, correct?
Right. But Medicare is for people that are getting 65 years old or okay. get Medicare because some disabilities.
Oh, correct.
So when you get 65, you can ask for your Part B, because when you get 65, you get your Part A. What's Part A?
Yeah, I was about to say, so there's four parts, right?
Right.
A, B, C, and D.
A, B, C, and D. A is for hospital.
Okay.
B is medical outpatient visit office, and that you need to pay a premium. So when you get 65, you start to pay a premium for the Part B.
Oh, do you?
Yeah.
So you pay into that, if you will.
For life.
For real? Okay.
Yes.
Yeah.
Right now is about 114, 116, depends on your age and when you get your 65 okay. years old. Part C is us, the Medicare Advantage company that manage Medicare programs. And Part D, that most people know already, is for prescription drugs.
Sure.
That is offered
That's
through
where
our
that
plan.
comes in, yeah.
Right.
And basically, C is basically coverages of both Part A and B, right?
And
but
D.
But
correct.
Involves you guys through this Advantage plan.
Correct, because yeah. the difference between the original Medicare and us is that we are going to offer the same benefit of Medicare, Part A and Part B, plus additional benefit, like Part D, like vision service, transportation, dental benefit that is very important in that age. So we are going to cover all that benefit from Medicare
right.
and this additional benefit from.
So make sure I understand this. To join the Medicare Advantage plan, you have to get A and B, correct?
You are going,
or sign
right.
up for A and B.
That's
yeah.
the basic requirement.
Right, right.
A and B, and of course, live in the parishes that we cover, and then you are guaranteed to be in a Medicare Advantage plan with People's Health.
Are there certain times of the year that one can sign up? Because, I mean, it's June now. Can you do that? Do you have to wait to, like, for instance, my healthcare here at Cox, we obviously do it on a calendar year, so January would be a new year for me through the calendar year, December to January.
Yes, that's very important
December.
to mention, because some people are confusing because this sometimes change during the year.
Okay.
And about 2 years ago, change. Right now, it's from October 15 to December 7 if you want to make some changes to your actual Medicare. But if you are getting 65, you can do in a period of 7 months, 3 months before, the month of your birthday, and 3 months
after. Oh, right.
After.
So there's you get this little window.
Yeah, you have that gap that you can enroll in a Medicare Advantage plan. If you are moving from another state to Louisiana and is under our parishes, you can also enroll in a People's Health plan. If you are getting Medicare because of disability, you have 27 months to enroll in a plan like People's Health. And another situation, if you have both
Medicare and
Medicaid. And it's important to separate both.
Right.
Medicaid is local. It's the state aid for people maybe doesn't have a high income or another kind of situation that they qualify for the benefit of Medicaid.
Medicare being the government.
Is the government.
Medicaid,
is the federal
Louisiana.
plan, correct.
Yeah.
And Medicaid is just local, and you need to apply for that to get the benefit. And if you get that, we can also enroll you in a better plan with our company, because it's for lower income people without copays, without need to pay more deductibles to your medical service.
Obviously, Hispanic speaker yourself, you know of the importance of making sure that the Hispanic community, the Hispanic market is served. And I'm not just saying in the sense of the community, but those who actually work are people that you know that are Hispanic speaking. They can actually communicate and articulate on behalf of the organization. That's a big benefit for the market.
Right, and I'm glad to talk about that, because the company brought me years ago to deal with the Hispanic market.
Excellent.
And now we have a lot of services included for the Hispanic market, with doctors that speak Spanish, employees from member service, social workers, representative, sales people, marketing people that can visit at their home to talk about our plan in their own languages.
And the nice part about it, real quick, you have activities that you do, upcoming health series. That, as a matter of fact, there's one coming up on June the 7th.
And that's always open to the public. You don't need to be a member of People's Health to assist to our health and wellness events. You can see on the newspaper, or you can go to our website, www.peopleshealth.com, to see more about our health and wellness events. It's open to the public, and we always give a good seminars with physicians, and it's very open to the public.
And I think the one you have coming up on June 26th is
that's only for the Hispanic market,
which is a Spanish language lecture about high blood pressure.
High
really
blood
important.
pressure.
Great information. Begins at 11 a.m. on Tuesday, June 26th at the Kenner City Park Pavilion. So good information there. And of course, real quickly, I know the folks at People's Health always greatly engaged in the community. I think that's important that a company like yours is out there representing. It's significant, and congratulations on the great work that you guys are doing there.
Thank you very much, and we are very proud to be here in Louisiana and sponsor most of the events and organizations here in the area.
Well, let's give everybody all the information you need to know in regards to some of the subject matter we spoke about, particularly with Medicare and Medicaid, and in the ways you can contact People's Health. You can go to more information, go to medicare.gov or medicare.gov. Also, you can call 1-800-633-4227. Or you can go TTY users can call 877-486-2048, and that's for Medicare. And for Medicaid, go to peopleshealth.com. You can call 800-978-9765, or in Spanish, again, as we were speaking, 800-226-4290 for more information on how you can learn about Medicaid and Medicare, and how maybe People's Health might be able to help you with that and get the information that you need, so you'll be in good shape. Jose, thank you so much. You did fantastic. I appreciate it.
Thank you very much.
And always glad to have you on. Always good to provide some health information and benefits to our viewers. So greatly appreciate your time.
Of course, and good health to everybody.
As well. Thank you to you, Jose. All right, everybody, that wraps up this segment of Cox Connections. We'll see you next time. Thanks for watching.